You're listening to Ask Dr. Jake. My name is Dr. Jake Tucker. I'm the owner and founder of Good Life Family Chiropractic, and I'm coming to you today with another message of hope, health, and wholeness. And really, I wanted to talk today about scoliosis. Scoliosis is one of these conditions that so many people are taught is just a pediatric condition, and you don't have to worry about it after that. So many kids are getting Harrington rods put in their spine. They're just propping themselves up. And so adults don't know what to do when they're diagnosed with a scoliosis. But the matter of fact is that while less than 5% of people under the age of 20 get diagnosed with a scoliosis, and it's probably lower than that. Last time I checked, it was between 2 and 3%. And what we see in adults is that by the age of 80, over 80% of Americans have been diagnosed with a scoliosis. And so what that tells me, and with my understanding of degeneration and how the spine progresses, and really being a spinal expert, my degree is in chiropractic care, but to become a structural correction specialist like I've become, you actually have to be among the top 1% of chiropractors in the world. Less than 1% of all chiropractic techniques teach correction, and they don't even teach any of those techniques in school. So I've had to do advanced learning beyond what most people would do. And through Max Living, I've been able to achieve level 2 certification in structural correction through each of these top techniques. So everything from chiropractic biophysics to Pedabond to the Clear Institute for Scoliosis Correction. This is where I'm at is in what we're doing. And so if you know someone that's dealing with a scoliosis, whether they've had a fusion surgery with Harrington rods or they've just had physical therapy, the danger in scoliosis is not the pain that it causes. The danger in scoliosis is that the tension on the spinal cord and on the nerve roots inside of a scoliosis decreases the function running through those nerve roots such that we see a decrease in life expectancy by as much as 20 years. And so anytime I see a scoliosis, I take this just as seriously as any medical doctor would take a case of type 2 diabetes, because there is no minor or mild or moderate diabetes. There's diabetes or there's not. And the same is true with scoliosis. There's scoliosis or there's not. There's grades and degrees of how bad it is. But even with a mild scoliosis, this is a serious interference in disruption in health. And so, so often when I'm seeing these, though, it's something that hasn't been caught. Most people that, are doing treatment for scoliosis, they're doing the medical route because a school nurse found this during a well check. But what we do is we're constantly assessing the spine and measuring angles. And so sometimes I'll find a scoliosis where even I wasn't expecting it. And this is the case of Haley. And so Haley came into our office because her parents were under care in our office. They were both dealing with headaches and neck pain, migraines, herniated discs. They were a mess. But as parents often do, they are more prone to worrying about their children than they do themselves. And in Haley's case, her mom, she said, can this help with urinary issues? And I said, well, I don't treat urinary issues, but tell me a little bit about what's going on. And she said, well, Haley's been needing to go to the bathroom constantly, except when she goes to go, there's nothing to go. And she's worried that she's going to wet her pants. And so she's putting, toilet paper down in her underwear, and it's just a mess. And this is a little girl who's 6 years old. And if you're watching on Facebook right now or following on YouTube, you can actually see in the video an x-ray of her spine, which is actually where we went to following this conversation, because she'd tried probiotics. She'd been to specialists for bladder infections and kidney problems, and nobody had found anything. They just put her on antibiotics just in case there was something that they were missing. And so when I got her, I was looking at her, I was seeing restriction in her motion, I was seeing postural abnormalities. And while I didn't suspect scoliosis, I knew that there could very likely be disruption in her spine, especially in her low back. And so we got these x-rays, and you can see that while this is not a severe scoliosis, this is a 9.5 degree curve over to the side. It's borderline scoliosis. If you're taught to round up, this is a scoliosis. If you're taught to round down, this is not a scoliosis. But either way, these sideways deviations of the spine of even 2 degrees is enough to disrupt the signals going through the spinal cord and the nerve roots to whichever level those nerves go to. And in her case, those nerves go to her lower digestive tract and her bladder, as well as her reproductive organs. And so I showed her mom the picture, and I talked about what that was affecting. And I said, let's try an adjustment. Let's see how she responds. And while not everyone responds this well on the first adjustment. The first adjustment that I gave Haley was the first one where she didn't feel like she had to go to the bathroom for the entirety of that day. And while I didn't fix it in one adjustment, over the course of the next several weeks and months, we were able to make such incredible progress that I could conclusively say by the end of that initial phase of care that she no longer had scoliosis. If you're watching, you can see the images on the x-ray. I know many of you are listening on Facebook. You can find these shows on facebook.com/AskDrJake, and on YouTube, just search for my channel, Dr. Jake Tucker, and you can see this, what we're doing in our office. You can follow the radio show and see some of these x-rays that we're putting up online and just the transformations that people are going through. And we get this type of results because we understand where health comes from, and we aren't focused on sickness and disease. Health comes from within, and really above, down, inside out is the chiropractic way of saying things. We give credit to God for the healing first and foremost. He speaks life into us. He breathes life. He created an innate intelligence inside of us that grew the sperm and the egg together into a single cell and duplicated and replicated itself 36 trillion times into this living, loving, thinking clay that's sitting across the radio or the internet from each other right now at this moment, listening and having this conversation. And that same intelligence is what keeps your heart beating. It keeps your lungs breathing. It heals a cut on your hand or your leg. It grew you out of nothing and it turned you into something, and it continues to animate and control you. But if you interfere with that intelligence, you will see a decrease in function. You will see malfunction happening in your body, and that malfunction, it will lead to sickness and disease, and ultimately cut your life short. And so that we don't want that for you. So whether you're dealing with scoliosis, urinary issues, low back pain, neck pain, headaches, sciatica, migraines, you name it. If you're dealing with any of those symptoms right now and we haven't evaluated your central nervous system, then pick up the phone and call my office, 531-289-7100. You can also send me a text message. That's 531-289-7100. Also, you can visit us on the web, goodlifefamilychiropractic.com. And while this is more of a common case, I guess I should say, is that we see scoliosis in kids. What's actually more common than that is for people to live with scoliosis and not even realize it. And I've shared Penny's story in the past, but I feel it's worth repeating just what she's gone through with everything in her life. I mean, she started off with just a little bit of low back pain, and that back pain was, manageable. She didn't really feel like she had that many issues, but she started complaining about it one day at work, and her coworker said, you should really go see my chiropractor. He's the best in Lincoln. He's doing some really cool stuff with advanced structural correction. Maybe you've got something that's going on that he needs to deal with. And so we got her into the office eventually. It took her about 6 months to get her to a place where she felt like she could come. And she sat down, we did the exam, we got the history, and we decided that it was pertinent to take x-rays. And you can see what her spine looks like. Now this here, this is her post film. If we go back into her x-rays, her very first x-ray here was actually both a grade 2 scoliosis and a grade 2 spondylolisthesis. And this was just a little bit of low back pain. Now, she didn't realize she had back issues until, her 40s or 50s. And it didn't start bothering her until later, but this is a problem that had been developing her whole life. And this is what happens when you grow up in a culture that ignores spinal health, which we do in the United States. We completely ignore our spinal health unless you happen to be amongst the 2% of people in the world that go to a chiropractor at all. And even from that perspective, less than 1% of chiropractors even know how to do structural correction. Unless you've been trained in chiropractic biophysics, Pettibon technique, or are certified through the Clear Institute of Scoliosis Correction, or you're a Max Living certified chiropractor, you just haven't been exposed to what it takes to correct a spine. You might have seen spines correct under chiropractic care. But that's more by accident than by intention. What we do is we focus on structural correction. So I often see this, fortunately, not usually this bad, but even with Penny, we didn't realize it was this bad until we took the x-ray. And when she saw this, she started to cry. But we walked her through, we told her what it would take in order to get that correction. I told her, look, this is going to take a while. This is like braces. When you're fixing a scoliosis, you have to be invested for your lifetime, because even when we get the even when you take those braces off, you're wearing a retainer for the rest of your life. You're making sure that you're checking in with your orthodontist to make sure that those teeth don't go crooked again. And that's purely just, how you look. That's aesthetics, maybe a little bit of jaw alignment and comfort in the jaw, but really it's not about function and health the way that your spine is. When you have a crooked spine like this is decreasing your life expectancy. She said, I'm committed to this. Let's do this. And so we started off and we wanted to stabilize her spine first. We did 3 times a week, and we did that for the first 2 months. And after 2 months of daily home exercises and chiropractic care, her transformation, you can see this if you're following along online, just incredible. Grade 1 scoliosis, grade 1 spondylolisthesis, much more stability. And that's what we want for everybody, is that kind of progress. And she's been able to continue to see improvements in her health. She lost 15 pounds just in this initial phase of care only by applying the chiropractic side of things. Not that chiropractic is a treatment for obesity or to help you lose weight, but when you start to restore function where there's a deficiency in function, you start to express health and life and vitality. And oftentimes that's expressed through metabolism. Oftentimes that's expressed through better sleep. Often this is, you see increase in brain clarity and lack of brain fog. And so that's what we want for you. If you're dealing with any of those things, if you're dealing with a little bit of low back pain and you haven't had it checked out, popping that aspirin or Tylenol is not addressing the cause. That pain is there to tell you that there's a problem. In Penny's case, it was a severe problem, a grade 2 scoliosis. But many of you, we don't even know. We don't know where we're starting. You're dealing with a little bit, and it might be a lot because you haven't looked inside. You haven't evaluated your central nervous system. You haven't seen an x-ray of your spine to even see the health. And so once we see that, we're able to sit down and build a plan. And once we have the plan, we know what the investment's going to be. And then we can develop a plan to take care of you and work that out with where you're at, how you're at, and how we get you here. Some of you will be driving from Omaha to our office, and that's not convenient. I get it. Some of my patients drive from over 2 hours away, and they get here 3 times a week because they're committed to getting well, to taking care of their health. But unfortunately, that's the state that we're in right now. I'm the only Max Living certified chiropractor in the state of Nebraska. Within 3.5 hours, you have to go to Kansas City or Des Moines or up to Sioux Falls in South Dakota in order to find someone that's certified at the level that we are here in this office. But if you want this care, I'll be as committed to you as you are to me. If you're ready to get started, let's go ahead and pick up that phone right now, 531-289-7100. Send me a text. Call me, and we will go ahead and get you set up and ready to go for that first visit. That first visit will just cost you $50. And what we'll be doing is going through the exam, taking any necessary x-rays, and getting ready for the second visit where we go over those together and start to see what we need to do in order to get you well. I'm Dr. Jake. Join me again tomorrow for another episode of Ask Dr. Jake.